This is Fever 94.3. I'm RJ Tia with you, and yes, I am bringing to you a brand new segment. It's called Surgeon on Air, and it's brought to you by Sironix and arthroscopy division of Healthium Medtech. And we have Dr. Neeraj Adkar with us. He's the consultant orthopedics, Saishree Hospital. Welcome to the show, sir. How are you?
Thank you very much. At the outset, I'd like to wish all the viewers on occasion of Dasara, wish you all a happy Dasara and well Arthritis Day also. Take care of your joints and bones. How are you doing?
I'm doing good. My knees are fine.
Good.
My
That's
joints
good.
are doing good. But of course, there is so much that is on my mind that I want to ask you today, because I'm sure these questions and your, of course, all the knowledge that you share is going to help a lot of people out there. So, सबसे पहले मैं आपसे जानना चाहती हूँ, what does a pain in joint generally signify?
So, pain in joint, whether it is due to some injury or without injury, that really matters. At what age a particular person is having that pain, that is also important. So if it is after injury, and say we are talking about knee joint or elbow or shoulder joint, then it suggests some internal injury to the structure like meniscus or ligament or some muscle injuries. If it is without any injury, then it could be because of arthritis.
Right.
The arthritis in simple term, wear and tear of the joint.
Okay.
Wear and tear of the articular cartilage.
Okay.
Cartilage acts as a lubricant, and that is responsible for smooth or frictionless movement.
Okay.
When it starts wearing out,
Right.
it is called as osteoarthritis,
Okay.
and that can lead to pain, that can cause pain. So based on whether it is injury or without any injury,
Right.
we generally then come to know what sort of condition we are looking at.
So a lot of times what happens is that we have a certain pain and we learn to live with it. We ignore it and we don't really consider a treatment or going to the doctor, and we learn to live with it. Do you think it's the right thing to do, or what are the consequences of that?
It's an absolutely wrong way to approach any joint pain. If you are having pain, it's better to consult your doctor at the earliest. Usually the patients, they feel डॉक्टर के पास जाएंगे तो वो सर्जरी बताएंगे, वैसा नहीं है. That is a myth.
Correct.
See, in our OPD also 80 to 90% patients we treat with medicines and physiotherapy. Around 10% patient they need surgery.
Okay.
But if you don't approach your doctor in time, obviously that small arthritic element or small pathology can aggravate.
Correct.
And unnecessary फिर वो complication बढ़ जाता है.
Right.
It's better to approach doctor at early stage so that you can treat it whenever it is in that stage, and then results are absolutely predictable. Physiotherapy plays crucial role in such elements, and people usually they tend to ignore these things. So that's it. From take home message would be approach your doctor at early stage.
And find out the root cause of it.
Find out the root cause and prevent complications.
Super. Now you spoke about arthritis. Now, which is the most common type of arthritis according to you, and who is more prone, to it?
See, there are various types of arthritis like osteoarthritis, rheumatoid arthritis, arthritis due to raised uric acid.
Okay, it's all common.
Yes, but osteoarthritis is most common.
Okay.
Is in simple word, it is age-related arthritis.
Okay.
So wear and tear which happens in the cartilage, it leads to osteoarthritis.
Right.
So it could be primary without any injury, or secondary. Secondary means due to some injury, trauma, fracture, it can lead to secondary osteoarthritis.
Right.
But cartilage, so that's the only structure which has no blood supply. It cannot regenerate.
Correct.
So patients, those who present pretty late with osteoarthritis, unfortunately, we don't have option but to suggest them surgical intervention. But early stage of osteoarthritis can definitely be treated with medicines, physio. In some patients, we do recommend some injections in the joint.
Okay.
So joint lubrication injections or PRP in certain subset of patients, they definitely work.
And is there any way to prevent it? Because there are a lot of youngsters out there. If we start young and we start taking care of it, is there any way that we can prevent it?
So only way to prevent OA is by doing regular exercises. keep muscle strength. That is very important. Your muscles, they act as a shock absorber.
Right.
Muscles are weak, then definitely that whole stress is on your joints.
Correct.
And it leads to OA or wear and tear of the joint. Secondly, this strengthening of your bones. Again, it leads to, it is because of, with the help of exercises, you can do that.
Yeah.
But most important thing which we tend to ignore and forget is keeping your weight under check. That is extremely important. Okay. Your joints, like be it knee joint, ankle joint, it has certain limit or capacity to bear.
Correct.
After certain limit, it is going to ache. Okay, so these 2-3 findings, these aspects are very important. Along with this, balanced diet. Our Indian diet is full of carbohydrates.
Yes.
We lack proteins. And proteins are extremely important for maintaining good muscle and bone strength. So these, basic things, if you follow, you can definitely keep arthritis under check.
Yeah, I think you're absolutely right. You said age, but also, there are a lot of youngsters, who have, I can, vouch for it, because I have been going through a lot of knee pain. And as you said, when I started exercising and I started taking my exercising seriously, it improved. And then I realized that, you can't underestimate the importance of exercise for so many reasons. And this is definitely one of it. So I also want to understand the stages of arthritis and how do we recognize them? Like, how do I realize that my arthritis has become very serious?
See, broadly, osteoarthritis. So we are talking about osteoarthritis here. This can be categorized into early, intermediate, and advanced. Technically, we classify it into 5 stages. But for common man, early is just beginning of arthritis with minimal or no X-ray changes. Intermediate, where there are certain X-ray changes, but definitely doesn't need any surgical intervention.
Right.
The advanced stage, where surgical intervention is mandatory or other, we don't have option. So advanced stage, obviously the symptoms are there for many years, and patient has ignored those symptoms for many years, and he or she approaches doctor at pretty late stage.
Correct.
So this is how we classify osteoarthritis, and based on the stage we offer treatment. So early stage, as I said, medicines, physio, and some injections are recommended in stage 2, and at advanced stage, corrective osteotomies to correct the angle of the bone, or joint replacement is suggested in some patients.
So these are the treatments that
Yes.
can be considered. So can you also tell us in detail about the non-surgical treatments like HA and PRP, and what exactly is HA and PRP? Something that I want to understand, and how does it help?
See, hyaluronic acid, it acts as a lubricant. So in osteoarthritis, because cartilage wears out, it leads to friction. Okay, bone starts rubbing against each other. To improve lubrication, hyaluronic acid is suggested. It also reduces inflammation inside the joint.
Right.
PRP is platelet-rich plasma. So patient's own blood is collected and it is centrifuged, and from that blood, platelets are segregated. And platelets, as all of us know, it has immense healing potential. So those platelets are injected inside joint, which help in cartilage regeneration. Because cartilage has no blood supply, it cannot regenerate on its own. That's where these platelets come handy and then definitely help in cartilage regeneration. But its role is there in early to intermediate osteoarthritis, not in advanced stages.
Got it. So on World Arthritis Day, sir, is there any message that you want to give to people out there? Anything that you want to suggest, advise, warn?
No warning from my side, but it's your health. You have to take care of it. Don't take your health for granted, okay?
Right.
You need to spend at least 30 minutes for yourself every day. Okay, exercise and balanced diet, so that you don't need to visit your doctor.
Okay, so Dr. Neeraj, chikungunya is something that is spreading, especially in Maharashtra, and a lot of cities people are suffering chronic arthritis, and this time it's come with arthritis is what we've been hearing, and as a layman I would say that, but what we know as to what is happening around us, is that people are suffering a lot. What do you have to say about chikungunya and joint pains?
It's very relevant question, I will say. I see at least 15 patients every day with this joint ache following a viral fever episode.
Yeah.
Typically, this viral fever would last for half a day or 1 day, max 24 hours. And after that, this joint pain, swelling, it triggers and which remains there for many months.
Yeah.
And it takes pretty long time to settle. Some patients, they get some chikungunya antibodies are there detected in the blood. Most of the patients, blood tests are negative, and we need to treat them symptomatically. Anti-inflammatory medication is recommended, followed by certain medication based on the patient's reports are suggested.
Okay.
So bad part is it remains painful for a couple of weeks and you need medication, but by say 6 or 8 weeks it usually settles down. But it's better to approach your doctor in early stage so that it will not flare up. Once those joints are swollen and inflamed, then definitely it takes pretty long time to settle. So approach your physician, orthopedician, rheumatologist, whoever your regular doctor at the earliest, so that treatment can be started in time to prevent complications.
So what kind of treatment? So you said medicines are recommended to certain people. Physiotherapy also, does it help?
So physiotherapy is not suggested or recommended in early stage. So,
Okay.
Whenever joint is inflamed, at that time it is better to start with medication, let that inflammation settle down, and then start physio to regain movements.
So I've been also hearing about hot wax. Do you have any recommendation on that?
Hot water therapy, hydrotherapy, or hot wax can be considered.
Yeah.
It definitely helps in controlling the inflammation or pain and stiffness. Symptomatically, patient feels better. That is one of the therapies which can be considered.
But it takes its own course of time. So age also has to do anything with this, because there are young people with the same complaint. We have old people, with the same kind of complaint. So age factor matters in this, or what?
So elderly with comorbidities like diabetic or those who are having pre-existing arthritis, they are taking slightly longer time to settle.
Yeah, okay. And any piece of advice to prevent yourself from it, or anything that you want to tell people who are listening to us and are going through that pain because of chikungunya?
Chikungunya, unfortunately, we need to take care, and prevention is better than cure.
Right.
But as I said earlier, start treatment. Aggressive treatment needs to be started in early stage of the disease. Don't just wait and watch. It won't settle down on its own. And so early treatment is key to success, I will say.
Thank you so much, doctor, for that very, very insightful conversation. It was wonderful being here in your clinic and speaking to you.
Thank you very much.
Fever FM, happening.